Hey, welcome to Not So Complicated, and I am presenting a complete roadmap to AMC Australian Medical Council for international medical graduates today. So this is our new video, and you will know what is AMC, what is the exam pattern, the exam fees, and the minimum marks and syllabus, and also what are the resources to study, and also the fee structure of the exams. You will know each of these features in here. So what is AMC? AMC is actually Australian Medical Council. It ensures that you are eligible to practice medicine in Australia if you are from outside Australia or New Zealand. So it is the AMC exam pattern. It is the purpose of AMC exam pattern, and it is split into two part: MCAT exam, like step one of USMLE, and clinical exam or workplace based assessment exam, like step two of USMLE. So pass rate of MCAT exam is 47%, and in clinical exam is 21%. Don't worry about this. This is challenging, but we will do it. So amount of seats and opportunities in AMC doesn't have fixed number like USMLE or PLAB. USMLE or PLAB have fixed seats, and the number of applicants are then matched into those seats. And according to AMC's report 2022 or 2023, then there were number of IMGs taking MCQs exam up to 4468, and taking clinical exam were 2053. This number is recently rising in these recent days because of the trend. There is increased trend of AMC for immigrants too, right? And also, instead of clinical exam, there is an alternative pathway which is also called workplace based assessment. We will talk about it later. And there is 99% pass rates in some programs like Newcastle's for this, and this is assessed over 6 to 12 months in real hospital settings. So it ensures the pass rate in clinical exam, but it demands you money and also 6 to 12 months of investment of time. So what is the exam pattern of AMC? There is step one, that is CAT MCQ exam. CAT is computer adaptive test. So total marks of this exam is 500, and total number of questions is 150. And type of questions include multiple choice questions with single best answer over 5 options, and you have to answer one of the options, right? And if you answered incorrectly, then there is no negative marking. So it is best to answer each of the questions present, and there is total time present 3.5 hours, and it is also computer adaptive test, which means if you answer correctly, the next question gets harder, but if you answer wrongly, the next question gets easier. That is the exam pattern in here. And there is no reviewing of answers when you submit one, so time management is very crucial. You have got 84 seconds per questions, and these exams is delivered by Pearson BUE, and there are a total of 352 global centers including USA, Asia Pacific, and Europe. So basically you don't have to go to Australia to give CAT MCQ exam. You can give the exam in these global centers right in your country too, if there is any center, right? And the second step of this exam pattern is clinical exam, and there is total score, and total score is based on 14 assessed stations and 2 non-assessed stations, and minimum score needed to pass this exam is at least 9 by 14 stations should be passed. And type of test is assesses clinical skills in patient scenarios like history taking, diagnosis, or counseling, lasting 8 minutes each, and total time is almost 3.5 to 4 hours. And there is alternative pathway for for this clinical exam, which is WBA pathway, and pass or fail depends on accredited providers. In the hospital you work like an intern, they decide whether you pass or fail in this pathway. So basically there is 99% pass rate in WBA pathway, so you can either go into this pathway too. So what is the syllabus? In syllabus of step 1 CAT MCQs exam, there are 6 domains to be included. First domain is adult health, in which 30% portion is covered by medicine, and medicine includes cardiology, respiratory, neurology, and adult health surgery. 20% includes general surgery, orthopedic surgery, and urology, and women's health includes obstetrics and gynecology. Child health includes pediatrics and neonatology. Mental health includes psychiatry and behavioral sciences, and population health includes epidemiology, screening, and vaccination. So the weightage of these questions, you can look at these 30%, 20%, and 12%, 12.5, 12.5, 12.5, and 12.5 percentage. And at least 50% of questions are pre-calibrated from AMC Handbook for consistency. So AMC Handbook is a question bank of AMC, just like USMLE first aid. The first aid is the answer bank or discussion, but this is question bank, and also it is available for clinical assessment too. And the questions blend basic science too, which include physiology, pharmacology with clinical scenarios like x-rays, ECG, and scans. So this is the syllabus of step 1 of AMC. And in step 2 of AMC, there are clinical exams which focus on core clinical skills like history taking, clinical examination, diagnosis, investigation, management, and communication on inpatient, emergency, and ambulatory settings. Any setting can happen in here, and these all core clinical skills are assessed in the surgery, medicine, obs gynae, and pediatrics. And decent marks for residency. So if you pass AMC, what is the decent marks for residency? Usually in AMC, there it doesn't tie scores directly to residency. So residency doesn't depend on the marks you get in these two exams. So passing both exams grants eligibility for residency matching, but it doesn't have any impact except that it will strengthen your certification and credibility. And securing a resident medical officer RMO depends on CV interview, references, and job market competition. That is what the major factors which decide whether you get residency in a certain hospital or not. And what are the fees structure for exams? So to confirm your medical degree that you have completed your MBBS via EPIC or ECFMG, that is AMC setup for primary source verification, you will need to pay 515 Australian dollars. And in AMC CAT MCQ exam, you will have to pay 2920 Australian dollars per attempt, and that is repeated in your next attempt. So basically you have to try to pass the exam in the first attempt to reduce the cost. And in the clinical exam, it is 3,991 Australian dollar for online session and 4,391 Australian dollars for in-person clinical examination. And in WBA pathway, it costs 5,000 to 10,000 Australian dollars. As I have talked earlier, WBA pathway demands you money and time, but it also ensures the pass rate in your step 2 examination. So basically you can go to the residency. And what are the resources for studying? There are multiple resources for studying, and these are AMC Handbook for multiple choice questions. This is for CAT MCQs, and AMC Handbook for multiple choice questions, zone more tags, general practice, Kaplan USMLE Step 2 CK lectures, and Tally and O'Connor's clinical examination. AMBOSS, there is a very much 15,000 plus questions in AMBOSS. And AMC Handbook of multiple choice questions is exactly the collection of past questions in AMC. So basically you have to go line by line in AMC Handbook of multiple choice questions. And passamc.org also provides you question banks, and AMDEX M plus X is also a resource for studying for CAT MCQs. You can tap into each of these and read from this. And for clinical examinations, there is AMC Handbook for clinical examination or assessment that is present in there, and Susan Wayne's clinical case for general practice. This includes real life scenarios, real life case studies in Susan Wayne's clinical cases. So you have to buy, or you have to get the PDF at any cost and read line to line for this too. And Tally and O'Connor's clinical examination is also a valuable resource for studying for clinical exams. And and Llewellyn Jones Fundamentals of Ops and Gynae is very important resource, and AMBOSS also. Geekymedics provides you videos and notes, and you can look at that too. And Elsevier, Australia Staley and O'Connor's videos, they are usually present in YouTube, but if they are not present, you can go and research for their availability. And what are the salaries during residency? There is 81,531 Australian dollars in the low end, and 107,103 Australian dollars in the high end. So it is a resource from target salaries, and it also reference from target salaries. And after residency, general practitioners means you have completed your residency, but you are not a specialist like cardiologist or neurologist, like that. So general practitioners earn around 100,000 to 300,000 Australian dollars, and specialists on 200,000 to 500,000 Australian dollars. I try to keep this video very concise so that it helps you with the optimum out of your time. And if you have any special requests, you can comment down, or if you have any other questions, you can comment down, and I will try to reply. And also subscribe for videos like this and clinical cases discussion, and also study with me series of USMLE step 1, which we will finish in a month or like that. We will crack every medical licensing exam there is. So basically subscribe, and thank you for staying with me.